On August 2nd, 2021, the FDA approved the drug Anifrolumab for use in people with systemic lupus erythematosus, also called SLE or lupus for short. Anifrolumab is kind of a big deal. It's the first type 1 interferon receptor antagonist that can be used in lupus. It's also one of the only new treatments approved to treat lupus in the last decade. This is great news. But the clinical trials of Anifrolumab were not all positive, casting doubt on the effectiveness of the drug. So who should receive it, and what outcomes can they expect from this treatment? Let's rewind for a second. At the end of November 2018, Anifrolumab completed its phase 2 clinical trial. The results were promising. Patients with moderate to severe lupus taking 300 milligrams of Anifrolumab every 4 weeks had a noticeable decrease in arthritis and rash compared to the placebo group. But the larger phase 3 trial called Tulip 1 hit a setback. It failed to meet the study's primary endpoint. In this case, that was how the researchers defined Anifrolumab as being effective. Here, the primary endpoint was the number of patients who achieved an SLE responder index of 4, also called SRI-4, after 52 weeks. To make things easier for you, here's the definition of SRI-4. In the Tulip 1 trial, 36% of patients taking Anifrolumab reached this endpoint at 52 weeks, compared to 40% of patients in the placebo group. Now, other metrics were tested in this study, including the Cutaneous Lupus Erythematosus Disease Area and Severity Index, also called CLASI, and the British Isles Lupus Assessment Group-Based Composite Lupus Assessment, also called BICLA. Both appeared to favor Anifrolumab. But none of these metrics were formally tested. The study's plan requires success on the primary endpoint first. Then it can proceed to the secondary endpoints. This gatekeeping approach may seem odd, but it's common in clinical trials. It's used to preserve the integrity of the study's plan. So our takeaway here is that Tulip 1 was a negative trial. But let's not give up just yet. Those other metrics, they did appear promising. Maybe the negative result was due to the trial's design and not the drug being ineffective. That's what the Tulip 1 researchers thought as well. So they decided to change the primary endpoint of an almost identical trial that was running in parallel to Tulip 1. They appropriately called it Tulip 2. The new primary endpoint would be patients who met BICLA after 52 weeks, and SRI-4 would become a secondary endpoint. And again, for reference, here's BICLA's definition. In science, we frown upon endpoint shenanigans like this. You don't change the rules of the game to help your team win. Now, apparently, these endpoints changed before anyone knew the results of Tulip 2. Now, if true, that's less eyebrow-raising than doing so after the results are already known. So let's jump forward now to January 2020, when the results of Tulip 2 were released. It shows that 48% of people reached BICLA after 52 weeks, compared to 32% of people taking the placebo. It also showed that 56% of people reached SRI-4 after 52 weeks, compared to 38% of people taking the placebo. This suggests that Anifrolumab was effective at treating lupus, according to both metrics. It appears to significantly improve skin symptoms and allow a dose reduction of glucocorticoids. That said, the drug doesn't appear to have any benefit for patients with joint symptoms. And the trial also excluded patients with neuropsychiatric lupus and lupus nephritis. We just don't know right now if Anifrolumab has any benefit for people with those symptoms. So you might be thinking, why is there such a difference between these trials? Salman and Neiwold wrote a great editorial about this. It's reasonable to assume that BICLA might be better than SRI-4 at capturing partial responses to a drug, or that SRI-4 puts more weight on arthritis than skin symptoms. But these probably aren't the case, since both Tulip 1 and Tulip 2 were almost identical studies. Probably the best explanation is just that lupus is a hard disease to study. There's likely many different types of lupuses, and some may or may not respond well to certain drugs. Dr. Michael Putman is the editor of Figure 1's rheumatology newsletter, The Differential. He's also a practicing rheumatologist at the Medical College of Wisconsin. In his recent newsletter, he writes that the takeaway from these trials is that Anifrolumab clearly has some benefit for people with moderate to severe lupus. The Tulip 2 trial showed positive results, likely because of improvement in skin symptoms and glucocorticoid dose reductions. That said, the drug doesn't appear to benefit people with arthritis symptoms, neuropsychiatric symptoms, or lupus nephritis. For him, he's interested in seeing if future research on Anifrolumab will further refine who will benefit from the drug. He's also curious to hear if patients themselves felt that the drug helped them at all. If you want to read Dr. Putman's newsletter or look at the sources we used in this video, we've left links in the video description. And don't forget to check out figure1.com, where you can browse through thousands of patient cases posted by the community.